So one of the things I like to do when I'm talking with patients is lay out all their options. So one of the most common things I'm going to do consults for is arthritis. There's a lot of different types of arthritis, a lot of different roads that lead to arthritis. But at the end of the day, that joint that's affected has lost its cartilage, it's inflamed, there's damage and trauma there. So there's the normal protocol for treatment. If we take regenerative medicine out of the equation just for a minute, typically people need to understand you can't fix arthritis outside of regenerative medicine. All the approaches that traditional medicine, or non-traditional medicine for that matter, uses are Band-Aids. The idea is saying you've lost cartilage in that joint. The tread on the car tire is wearing down. You're losing function. It affects your quality of life. It's painful. So normally what they'll do is say, first, take some anti-inflammatories. Take it easy. They'll maybe recommend physical therapy, which actually, honestly, out of all the options, that's a great one. Strengthen the supporting muscles that support that joint. But after NSAIDs, then maybe the next step is they'll offer cortisone, a steroid shot. That's not without its risks. You can only do it so often for a reason. It can thin the bones, lead to fat atrophy, and lead to some other complications, and actually cause further thinning and deterioration of the cartilage. It weakens the cartilage. But the devil's advocate argument would be, but yes, doctor, and those patients, their quality of life is such that we have to do something now. So they can't fix or undo that arthritis. They'll do the cortisone to reduce the inflammation, even though they know you're kind of robbing Peter to pay Paul. But you're going to buy them a little time if it works well, depending on how severe their damage is. They may offer Synvisc or that rooster comb shot people have heard about, hyaluronic acid. And you know what? You might buy them a month or two if it works, maybe 3 or 4, but that's it. You're just giving them a temporary lubrication in the joint that wears off pretty quick. You didn't permanently change anything. When all that fails, then usually if your quality of life is such that you're telling your doctor we have to do something, depending on your age, they'll start talking to you about surgery, partial or complete replacements. Now there's risks with that because once you ring that bell, you cannot unring it. So if you do the replacement and it turns out well, then great. You'll probably get 15 years on that knee before you're going to have to replace the replacement. That's assuming everything went well, along with all the physical rehab and everything else that goes along with it. But what if it doesn't go well? What if you do that replacement, you do that surgery, and you're left with pain, worse pain, left with infections? We all know people who've had to have multiple surgeries due to chronic infections because now you have a foreign object in your body. It's not without its risks, but it has a role to play in the treatment protocol. My argument is it should truly be a last resort because once we go down that path, there is no undoing that. So now let's take regenerative medicine and throw it back into the equation. So this is what I love about it, is you're actually trying to get to the root of the problem, okay? Outside of regenerative medicine, it's all Band-Aids. I've got one Band-Aid after another to buy you as much time as we can before the inevitable surgery. With regenerative, what we're trying to do is say, no, let's stop that. Instead of a Band-Aid, let's get in and address the root problem. Try to actually change that environment, that structure, what have you, so that you can buy them a few more years or longer on that joint, depending on the patient, how far gone they are, a lot of these other nuances. So you're actually getting to the root of the problem. It's in the name. You're trying to regenerate, repair. And so I love that because when you're using a patient's own stem cells, what's my downside? It didn't do anything. But guess what? We did not ring a bell that we can't unring. Every other option is still on the table for you. So here we have a minimally invasive procedure with studies that validate safety and that it can work. That there's really, the worst case scenario is that patients couldn't tell a big difference a year later. Well, at least we've not gone down a road we can't undo. So, me personally, if I was a candidate for this, and I had a problem, of course I would try this before I ever resorted to a surgery replacement. But you know what? There's always going to be a role to play for replacements. You know, you're never going to, let me rephrase that. Regenerative medicine is one more tool in our armamentarium with which we can treat patients. And we should incorporate that as an option for the right patients when it has the ability to help so many patients.